Hi everyone, and welcome to week 3 of our discussion. Pretty exciting that we're here already. So for my high this week, really my high is a family get-together. We had a family game night, which is always good, especially when your kids are approaching 30 years old. It is definitely good to have them all together. My low this week was a very good friend of mine. Her father passed away. So seeing a close friend suffer is not easy. As far as a tool that I use in my current work, one of the ones that I think of is our fall risk assessment, the Johns Hopkins tool. A bunch of different questions that help to establish risk for our patients. We all know that falls increase while patients are in the hospital, and figuring out the risk factors and putting the appropriate interventions are definitely going to mitigate some of those problems associated with falls, because we know once a patient falls, depending on their age, they're more likely to have mortality. So for the Johns Hopkins Fall Risk Assessment tool, they have they categorize into high risk, low risk, or medium or moderate risk, while asking different questions. The next would be age, really asking between 60 to 69, you get a certain point value, 70 to 79, a certain point value, and then if your age is equal to or greater to 80, you get a larger point value. The next is fall history, and that applies a point, elimination of bowel and urine, medication, patient equipment, mobility, and cognition. Each one of these categories will have a numerical value established to then total up, and the sum will equal your risk factor. Based on that risk factor, certain interventions will be put in place. Those interventions, as I talked about earlier, will help to mitigate some of the risks of falling. And as we know, this is our best guess or estimate to really try and put some things in place to help keep our patients safe. Another thing that we do know is this tool is validated. So it's important that if you're going to use a tool for your greater population, that your tool is validated. And that is it for this week, and I hope everyone has a great week. I look forward to the video post.